So yes, thank you, Dr. Malau, once more to join our ongoing conversation. And I have been thinking this morning before we started and preparing to set up the equipment, and I was thinking maybe I will kind of have a separate, let's say, a podcast that kind of talked about this thing, because it may um, separate from my other videos, so that it will have an audience of its own. So that's something that I've been thinking. So just letting you know, in case that comes up, and then when I get it going, I will let you know.
Problems. I think that's an excellent idea, because I think we need to organize ourselves in all fronts. And my aim is basically to help you, because I know you've got the right sense of thinking, the right sense of integrity in you to be able to do the right thing. I think you find very few people like that these days. So that's why I'm really blessed by your intentions and your vision to do the right thing, and I'm here to support. That's all. That's basically my aim. Yeah, thank you.
I am also hoping that I will get other health experts on board who are willing to free to talk and express their opinion. I know that we have a very reserved kind of mindset, where we are not sometimes encouraged to speak, and that sometimes we get pushed back on our opinion and point of view. So generally, within the medical fraternity, I have experienced that my colleagues have things they want to express, positive comments and to improve things, but because of the culture, the system that we have created, or expectations, my colleagues tend not to freely express themselves. Not that we are against the establishment in any way. We all want to see things improve. And this is my way of sharing my view and thoughts. And thank you for coming on board. You're a very senior person, senior health executive, and I really appreciate your time and your comments.
No, spot on. I'm here to do what I can to help you do exactly what you're saying. Bless you.
All right. Going to our topic for discussion this morning, and we are still talking around health systems. In particular, we are talking we're talking about or around the provincial health authority system in Papua New Guinea. We have limited our discussion within PNG borders and have not gone into regional, even though I know you had experiences within the regional health sector. So we are still focusing our discussion on public health system in PNG, and the system that we are using is called the Provincial Health Authority. To kickstart our discussion this morning, my first question is, how can the PHA system be evaluated or reviewed to say that it's working or it's not working? And that's a question that has been recurrent and coming up. So I want you to kickstart our discussion by asking you that.
Thank you very much for that question, because it's critical to understand the history properly. I think it's really critical, because there were people involved in the process that need to be acknowledged, I think. Acknowledged not for them to, like fighting bros, show off, but acknowledge it and ensure that there's a clear understanding of why the PHA was created. I think it's critical, because at that time that I remember very well, because I became Secretary for Health in 2007, and Sir Peter Bata, late Sir Peter Bata, was the minister at that time. And he had seen the relationship between the hospitals and the rural health services very clearly. He also, I think, together with the way understood the way that the Constitution was created, under which there's so many, that's again my understanding of why he got me as Secretary for Health and why he wanted to transform the health services, to make it better. At that time, he felt that it was not working well. He presented the Act, 2007 Act, the PHA Act. And the very basic question I think we need to ask is, that Act, why did he create it? If we understand that, then we are able to work out whatever reviews that are made are able to forecast on that. And that's why I'm talking about the history. History is important to understand all these things, why people do things, and what we must do to correct those things. If what they did was wrong, okay, let's shape it properly with proper evidence. And then we find out what we must do to improve. So I think that's a basic question we all need to ask before we really look at a PHA system. I have got my own opinions. I've got my own experiences that I can share, but it is the people that are doing the things right now to do those things, review those properly. And that's what I think a review should do. The review should look at the history, what was intended to be done, and if that was done well or not. If it was not done well, then you correct it.
Right.
And that's how I think things should go.
You mentioned the PHA Act. From your assessment in how the PHA system is being rolled out in the provinces, is there a disconnect between the law that was set up to establish this system or this organization and how it's being implemented or operationalized, if I can put it that way?
And yes, thank you very much for that question too, because that again highlights a question of, have we seen that act properly? Have we seen, like I mentioned, the national constitution, how it aligns with that? In fact, that act also cites very clearly, right up front, that in fact its main purpose was to make sure that people that the country is serving are treated well, are given the right ingredients of medical practice, whether it be clinical or public health, to do the right thing for everybody. So it expresses equity. It also aligns with the General Public Service Act. It also aligns with that at that time, between 2007 and 2011, there was the creation of the Vision 2050 of the government of PNG. So all those factors need to be looked at. Why was the Vision 2050 of government done? How it will align now with the progress of the nation. It's not just health. There's so many factors outside of health that influence health. So one needs to look at those things, those factors comprehensively so that we can serve everyone in a country with proper respect for each other and so on. And then, basically analyzing what are the major burdens of disease. What is affecting our populations in different parts of a diverse country? And these are the sort of things I think a review should look at. As far as how it is done right now, I think all these need to be put into place properly. Otherwise, what's happening now is not appropriate. Let's just be honest, I think. Be honest and analyze those things properly in an honest way. Whoever is an authority must do that. It is the role of that person in authority at each level of the health system to do those properly.
Thank you. For those who maybe like when I say I'm including myself, who kind of aware of a review, but have never been involved in one, or say for a general person who is hearing our conversation or watching the video, what does the review looks like? Can you walk us through the process of, say, if we decide to have the PHA review being done?
Well, I would say look at the history. as I said earlier, just look at what's happened in the past. Have a proper terms of reference that does this properly by consulting with as many people as possible. Don't just look at yourself in a small corner of a unit or a department. Look across, look at other sectors of government as well. See who you can call on to support you do the right thing for the good of everyone, all citizens of our country. I think that's what the terms of reference should detail, and start looking critically at why systems are failing, and then work out at each level. And I did mention this standard at one time earlier in our discussion.
Yes.
That's why the National Health Service standards were created, so that at least they could look at each level of facility, what role each of the human resource within that facility will play, so that you have a holistic approach to addressing health services in the country.
Right, thank you. So is that process, is it something internally that the department does, or something that we need to engage externally, or is it done by a committee, or how does it get established to kickstart that process?
Excellent question, because that's where you look at, it has to be done internally first. Internally, this is really critical. This is one of the things I keep on trying to advocate for. That is, let's look at PNG, the PNG way. It's all in the Constitution. PNG is a diverse country. Different provinces have got different burdens of disease. Highlands different from the coast. So it's obvious we need to look at things differently at different parts of the country. Is how we actually analyze all those together and make sense out of what we must do for each province. And that's why I think many of our political leaders, that's why that decentralized system of government was created, so that people at each level would articulate things. And I must say again, what my governor keeps on saying these days, Governor Bird, about getting financing to the provinces, which is critical. He's saying the right thing, but we're not trying to look at how each of the provinces and districts can apply health services delivery in their environment and do the right thing in their environment, and do that first before we get outside consultants to come and help us have the international perspective applied. That's how it should be done. Yeah.
Exactly.
Yeah.
So in other words, the review will have to be done internally, and that would involve going over past documents, plans, policies, laws, interviewing people. I see. And put a report together for the department or the government to act on. So leading on from that, is that review would be different from, say, measuring KPIs that comes with the health plan?
Yes, okay. KPIs, that's very specific to the plan. So the KPI should be derived from what you find in your review. And then you do that thing precisely, and then you monitor and evaluate over time. Okay, the basic things I find is that, okay, in like we've got 10 million people, assume, it's an assumption. It's an intuition. It's intuitive evidence that I'm saying, 10 million people. Because for a long time, people have been trying to do the database for individuals, properly looking at every individual, every citizen in the country, so that we can have a correct population to do the analysis accordingly, for the denominators are correct.
Yes.
And then when we do our disease burden, we find our numerators. And then we do all that properly, so that we will have a clear picture of the burden of disease, the population that's being affected by district, as I said earlier, our country is diverse. It's got diverse disease patterns, and not many outside consultants we get, for example, they come and they think that global standards apply there in that location.
Right.
And so we basically miss the boat because we are not analyzing ourselves properly to discuss with them, frankly discuss and say, look, this is what we want, not what we think we want, based on global standards set, but this is what we want. And this is where I'd really love all our public health officials to read our national constitution, because it has everything there that we should be applying to make our country independent and free. And that independence and free with true health can be possible, I think. Is possible.
Thank you. You keep referring to the national constitution. How important is that document to say our health system, health plans? I know you are a very strong human rights equity advocate. So yes, please, can you share a bit more on that?
Yeah, thank you. Well, the national constitution has those 5 key things in the preamble that tells you everything. One of them is exactly what you're saying. One of the things I said earlier too was this PNG way. That should encapsulate the way we do things in health. And I must say too, from my own experience, I found that the 2011-2020 National Health Plan was based on that, basically. Based on the plan, based on what we were seeing with the Vision 2050 of the government. So I'd urge all public health young people, just look at the constitution and see how you can do better for the good of everyone. It applies equity, it gives you everything. So comprehensive, that PNG way. And so we cannot shy off from it because that's our country. We've been illegally determined to be Papua New Guinea under that constitution. Therefore, let's do everything the way it is supposed to be prescribing us to do things.
Thank you. I know in our previous discussions, you say that the PNG way. So let me expand and unpack that, and maybe okay. Let's say if someone is listening or watching, and they want to do it, and you know, as you correctly pointed out, we are so diverse. Using one example, how will that look like? How does that look like? Say someone wants to take that approach.
Well, maybe I should cite my own experience with the National AIDS Council thing that we did. The word QAP, sexual intercourse, mentioned in public. Wow, everyone got really uptight about it. In fact, some did send nasty messages to my own family, you know, this sort of things. But when you look at it in a culturally diverse society, how would one try to work out what you must do to help everyone? So basically, that experience, I think, taught me an awful lot, together with my education at Harvard. And the person, some of our mentors was the very, very, you know, outstanding mentors that give you certain values in life, like Professor Jonathan Mann, the champion in human rights, as you said earlier. So when people teach you things, at least I was fortunate, I was blessed by God to go to these institutions like that, to be given that, those insights into human rights, equity and development and that sort of thing. So using those experiences, you think very simple things, not complicated. Because when we started doing the AIDS program, that's what I did. Seeing Sepuka Temu, who was then my boss, and as chairman of the council. He directed me, said we do the advocacy, and we did that based on the understanding that yes, our Papua New Guinea was totally diverse. How would we use this word, sexual intercourse, in public for a public health purpose? You know, you go to, so you analyze it in such a way, then you go through a process where you find out who will be the ones who will give you negative things. Go to the censorship board, you go to at least the religious groups, going to the Catholic bishop to let us know, you know, whether it's correct or not, and no answers. So as a public health official, as a person who's been primed to look at issues and do the specific things that's required, you just take action. So the word "quap" was expressed in public. And now you have condom distributed everywhere, both in family planning and use of prevention of HIV/AIDS and so on. So there's a process that one could go through to make sure that we do the right thing based on our own environment, not just, you know, plucking things from the air and getting things without proper evidence.
Yeah, I have to completely agree with you. One of the things that I learned in my MPH course was being or the need to be culturally sensitive and having a health system that is sensitive to the culture where it's operated, and having a very diverse country like PNG, as you mentioned. Perhaps the PHA system needs to kind of, as you say, the PNG way, or wherever, which province is using it, need to be also cognizant of the cultural expectations and how it will deliver service within that context.
Right, spot on. That's it. That's it.
Going back to the review discussion we had, I wanted to ask you this additional question was, in terms of each PHA doing their own review, is that something that should be a routine service or routine function, should be ongoing, or is that designed in a way that it has a predetermined time where it's done by each PHA?
Yes, I think in the Act too, it prescribes the PHA to act in such a way that the PHA, the CEO, actually takes ownership. This is the good thing about decentralization and how it implicates on PHAs. The PHAs are a decentralized entity to do public health and clinical services in the through one mechanism. That's a simple assessment of it. So if it's excellent for decentralization because of the cultural diversity that we have. So it's been put there for a purpose. And that's why I keep on referring to the Constitution and all these sort of other things. Because unless we understand that as public health officials, when you're a doctor, you're a doctor. When you're public health, you add in that little, you know, experience behind it, and you'll find that as a clinical person, based on your like differential diagnosis analysis, you work out those basic things. Okay, fever. How did fever come about? Similar sort of assessment one makes, and then you come up with the actual, hopefully, the goods for the good of all, I guess.
Thank you. Now I'm going to speak. I'm just going to share a bit of my experience, and again, so I started off from the lab as training to be a pathologist. Then went to primary care, or we might call GP practice, and then now into public health, bit of a foot in each. And one of the things that I have realized during that this transition from a fully clinical to now kind of 80% public health and 20% primary care. Our training in this biomedical model of health, where we are thinking very individualistic diagnostic process, treatment, it's very difficult to change, especially doctors who were trained in that model of training in medical school. And then as they are progressing and with limited public health training or experience, and put in a CEO role. And unfortunately, and this is my observation from afar, many are still thinking very individualistic and not population health approach in the PHA system. And everything that they are introducing is very targeted, individualistic, but not improving process and not covering the population level interventions that I realized that I wasn't trained in, but I needed extra training and experience doing it before I found comfortable changing my actual thinking in that way.
For that, because that is what's needed. That is what needed, what doctors are needed, because that's how we, at least in our time, in being graduated in 1980, that's what we went through. We saw this, and then when we went through doing practice in, like in the National Department of Health, we realized, in fact, so what you're actually expressing is what needs to be visualized by all young people wanting to do public health, not just public health, but wanting to do good for the person on the streets in Port Moresby or out in remote rural areas. The total different people we're serving. The Port Moresby street person and the rural person. How do we put that together to make us think about the whole country? I think that is what's needed. So thank you very much for expressing those. I think that's a way to go.
Yeah, thank you. I was just thinking about something and just slipped my mind. Oh man, I think it was something to do with the review process, and I wanted to kind of get your thoughts on it. And okay. Now this one of the things I realized is having the capacity to analyze data internally and using the data to make decisions rather than how someone feels at the moment or at the spray of the moment thing. That's something we need to change in decision making.
That's spot on, because that's the purpose of the PHA. You just touched it again. You see, in a decentralized situation, the PHA sits down, the CEO is now responsible for both curative and clinical health. It used to be different. That's why Sir Peter said, look, let's put them all together. So if we have that done properly, proper evidence by LLG or by district, imagine the LLG has got a community health post. So you structure, that's why I keep on coming about this National Health Service Standard, because then you structure all those things, and then you have the human beings working in each level, because each of them have their own terms of references. And then you do those well, and then you look at the whole system systematically. So as you go higher in your, say, public service career, you'll find that you become higher and higher, and then you realize your vision of your country. And then you realize the vision of the national constitution. As you go up higher, then you are able to say, as a bureaucrat now, you now take control of all these systems. In province X, what's happening? Province Y, what's happening? Then you have a clear picture of what's happening in the whole country. So as you go up higher, and then you're able to get your political leaders to say, look, this is what's happening in my province. Can you help me do this? But right now, sadly, there's no link even between the evidence and the politics, sadly. I think that's what we need to come down to if we're really serious about making a difference for our country.
I completely, 100% agree with you that disconnect. The decentralization process looks like it has a flip side, a negative side to it, where when they're given a lot of leverage, room to move, and depending on who is in charge, and if they're not thinking or cognizant or have a passion for improving health, they will make decisions which they are authorized to do in a negative way to pursue other interests. And that seems to be the negative side of giving more power or more autonomy or more room to move to PHA executives or CEOs, if I can put it that way.
Correct. And it's also in politics as well, where the politics now are taking over, and you have me, I'm the minister, me, I'm the, governor, so I'm going to do what I want, and that's it. And the money, now financing come into this. Where does the money go? I mean, we're just talking about, let's say, the public service, for example. Last week, or when did we discuss things about there's some complaint also on WhatsApp on how we on the public service structure and how we do that. We are talking about, for example, 9,000 public servants. That's 40% of the whole workforce of the country doing things. And we're dealing with 10 million people. So the public servants, the 9,000 of them, we're talking about how we now have our own insurance schemes. So what proportion of the population are we talking about? I mean, for the PNG population, for insurance. You see? So that's the sort of thinking I'm encouraging. Okay, think of your unions. Fine, that's great. But always have at the back of your mind that you have a financial management. The country is ridden now with so many loans. I don't know how many billion now loans we're taking. And we'll continue taking loans. Now look at our whole assets that we have for the country. Sorry, we're going a big different, we can talk about this later, but I just wanted to express the implications of what we're talking about in the financial sense as well. That's all I want to sort of say. There's also financial implications. Where money goes, if you don't manage it properly by each province, you'll find the money will sway into one channel, and then there's nothing left for the other.
Thank you for highlighting that. We can definitely have that as a separate discussion, maybe next week or one of the Sundays soon.
Yes.
And that's health financing, and including health insurance, and the question whether Papua New Guinea should have a publicly funded health insurance. Will it benefit? Will it not? And how should be operationalized? Because there are a lot of turning wheels that make it function, and setting up a simple company with 5 employees doesn't make a health insurance system for a population of almost 10 million people, and there's a lot of things going on. And with my experience studying in Japan, then working and living in Micronesia, and now in American Samoa, so I kind of have a feel of how the health system operates in these advanced countries and what it takes to make it function. Mind you, they do have their problems and controversies and such, so it's a big total discussion by itself. And I am no means an expert, but
yes, I'm not too tough.
Hopefully we can share some of our own opinions in the next Sunday or the Sunday after.
No worries. No worries. Will do. Yeah. Thank you.
We're kind of coming towards the end of our discussion for today. We just wanted to focus on the PHA system itself, just unpack it, making sure public or our viewers, listeners from PNG watching can really understand how the system is functioning, how it operates, how it's improved from the top at the national level, fitting it within our constitution, and so that it's working with other sectors. And many times, because the public only gets service at the point of contact in ER or outpatient, and behind the scenes, they are not sometimes aware of it. And this discussion that we're having will shed some light to the public, as well as maybe put one or two thoughts in health professional experts who are watching.
Well said. Well said. Well said. Excellent. I guess we can, yeah.
Any final thoughts before we wrap up?
Well, final thoughts. I think it's also sometimes worth thinking of, people that went before us. I mean, Quinton Riley, who tried their best. I think it's really important we value those people. I mean, Quinton Riley, as I said, Sir Peter Bata. I hardly see people acknowledge them in public health circles. I think it's important we look at those as our pillars that sets the foundation for us, that gave us the experience or the living, I guess, knowledge of things, and try and align that to what we're doing today going forward.
Thank you, Dr. Malau. Beautiful comments to finish. Yes, indeed, the saying that we stand on the shoulders of giants is very true. Dr. Malau, you are a giant in your field, and I'm sure people like us and whoever is going and trying to improve our health system are also standing on your shoulders, and you stood on the shoulders of others. And definitely, as we preparing to celebrate 50 years of political independence, let's acknowledge those. And I guess perhaps we can have one or two sessions to just acknowledge those who have done their bit to set the foundation, the bedrock on which our health system operates.
Thank you. I think that'll be nice to look at history. Thank you. That's nice. Thank you.
With that, have a great week, and I will see you next Sunday.
Thank you so much for that, and please, we'll catch up on Sunday.
Yeah, thank you, and bye everyone. Thank you for watching.
Thank you.